We have at Cutler2010.com a long description of Maine Wellness, which is our plan to do the following three things in the state of Maine. One, make sure that everyone in Maine has access to essential health care services. Two, at a cost that's affordable and sustainable. And three, in a way that emphasizes prevention and wellness. And it's a plan. It tells exactly how we're going to do it. One of the reasons that we're in trouble today, one of the reasons that 60% of every dollar we spend in the state of Maine on health care goes to the care of chronic or preventable disease, is because we're spending 25 to 35 cents of every dollar we spend on health care to insurance companies, health insurance companies. We have accepted the notion that health insurance companies should be the organizing principle of our healthcare system instead of the relationship between providers and other caregivers and patients. I want to restore that important relationship. Now, we can beat our breasts and shake our fists about the new Affordable Care Act, the federal legislation, but it's law and it's likely to remain law. And what we need to do is figure out how we can use the provisions in that act to help Maine lower the cost of health care and expand access to it. Mayor LePage has suggested that the answer lies in insurance. He suggested that the answer lies in making available to some Mainers a $132 a month policy from a company whose complaint record in Maine way exceeds the state average, from a company that has a history all over America of denying claims and denying coverage. That's not the answer. The answer does not lie in more reliance on health insurance. The answer lies on creating relationships between people and caregivers.
Next question goes first to Kevin Scott. What do you believe the essential services are for Maine seniors, and how do you propose to pay for those services if elected governor?
The essential services that I see from where I'm sitting are probably best known by the Maine Association of Area Agencies on Aging. In our local community in Andover, which is very rural, obviously transportation is critical. Good nutrition and access to dietary foods in a diet that makes sense, are critical for some folks that are home alone and don't have someone looking out or checking in. But I know that the answer to this question is right out here in this room. I haven't been working with elder care my entire career. You know, those services that are critical can be identified to an executive, be identified to a leader who's going to push forward those agendas that are already out there. I don't know how many of these forums I'll have to sit through where a candidate says, our plan is exactly what we need. Somebody help me out with that. Is that really what you want to hear? That somebody at this table knows exactly what you need? I think not. What you want to hear, and what I'm prepared to say, is exactly who I am and how I operate. I am an inclusionary decision maker. I drive policy based on common sense and outcome, period. Enough of the conflict with parties and national interest. Let's get down to the community and advance those services that are most critical. Paying for those services comes right back to priorities. You've got a budget of $5.7 billion for 2 years. What are you going to do with it? You want to spend it on making services available in your community for elder folks? Or do you want to go build a bridge or do some type of historic preservation? We've got some tough decisions to make, but I will tell you right now, unequivocally, I will be the biggest advocate for making certain that our priorities are on elder care services in our communities. Critical.
If I may say, years ago I was asked, what is it that women want? And the answer is women want the same thing that men want. Seniors want the same thing as young people want. They want decent, affordable housing, they want health care, they want a sense of community, and they want to be a part of their family and to enjoy the extraordinary quality of life we have here in Maine. So with that, there are some specific things that I would do. First of all, Maine is on the short end of Medicare reimbursements from the federal government. There has been a great move afoot by our congressional delegation, and I would join them in advocating that Maine physicians be reimbursed at the same level as the Boston market. We are sorely underfunded funded, if you will, from the federal government to help take care of the medical needs of our seniors. Because no matter how much prevention we practice, no matter how much health care how much we take care of ourselves, there's going to become a time when you need the assistance of a physician. So we need to fight to change that rate. Make a priority in the budget that I would submit to the legislature of increasing the level of home-based care, because I sincerely believe that it is best for the seniors to have that choice, and in many cases it is less expensive in the first place. So advocating for things that keep seniors mobile, independent, and engaged in their communities. And sometimes I am concerned that when people talk about the percentage of our population that is aging, it's listed almost as a negative. And as I sit there and hear that, this is a great opportunity. The talents out there can indeed help us solve that, and they're going to have to step forward to help us write the next budget. Many people on the panel continue to say that we have to get government spending under control. Government spending is a blueprint for our family values, and it has been cut sorely, and we have to look very carefully at what you and we support.